Hi, everybody. I'm Angela Lacy-Salisbury, and I am thrilled to be here to talk to you today about possibly my life's passion, which is NeoGen PSR, and the way the treatment evolves with your learning, with your skill, with your patience, and how I have evolved this treatment in the US. So this is us, Emergent Med Tech. We consider ourselves leaders in regenerative aesthetics because NeoGen is our foremost function, product, and focus. So we've won, and our owners have won many, many awards. Come on. No, I didn't mean you guys. I actually meant who's moving the slides. Because it does not appear to be me. Where? Oh. Okay, here we go. I'll tell you how this whole talk is going to go. When Simon asked me to speak with you all, the first thing he said is, be subtle. And don't show any fannies. And I am never subtle, but I've chosen not to show any fannies. So, well, either one, I think they're the same. I haven't checked out your anatomy, but I think it's the same. So this is me. My journey began with this scar. The scar that you see here, that has had 3 NeoGen treatments, that I used to be able to put these very long fingernails directly into. That is life-changing. When I do it for a patient, when we do it for a friend, when you see it in the field, it changes someone. Don't ever think because you're using a medical/aesthetic device, you're not changing lives. You absolutely are. I wanted to push the energy. I hated the downtime of NeoGen. I hated the fact that nitrogen plasma energy transfer had to be as aggressive as it was in order to get results. And it didn't. When I got my first treatment, I looked like I was clawed by a bear when I was healing. I was doing vinegar soaks 4 times a day. I was not pre-hydrated. I was treated dry. Now, the first thing when I got to know this energy well was implementing in the United States 2 weeks of electrolyte supplementation before treatment. Never fail. Fail on anything else. Do not pre-hydrate your client. This energy is only drawn to water, but it actually needs the magnesium and the salts for helping with the growth factors. So pre-hydrate with your electrolytes, added water, reduced intake of everything. Just keep that hydration in. So establishing that fact before and then after, continuing with the electrolytes after treatment. They need that support again for at least 2 weeks. Then making sure we move them into a very hydrating moisturizer to continue skincare after. We can now push the energy a little more, so we did. And the results were good. They weren't out of the ballpark phenomenal, but they were good. So we had to think differently. Think, and I challenge every one of you to think differently with this energy. It's capable of so much more than you think. So one of the first things I thought of was, I'm watching one of my nurse practitioners who was a threading expert. She'd go out and lecture on threading. And I hated them. I'm going to just say it. I know they work for a lot of people. I don't like anything invasive. So I sat with her and had her teach me where the placement was in the face. And I said, why don't we start using the energy that way? This is when we started changing. So I worked with Susan and got down the patterns. And then I started teaching them to my offices. Once I realized there really is a dynamic difference in lift. So in the eyes, when I train to treat, My eyes are always dramatic. This is very light energy, but still using the vectoring. This is light energy because Latin American. This is when I started to go really high. So always do I teach 2 lines above the eye, starting at the fold, the natural fold of the crease, never below, and then doing a pass of small vertical strokes across the brow bone. That's the magic. That's where the wow comes from. If you really need added lift, add in an isosceles triangle above the eyebrow. Work vertically in it. You'll get added pull. Mid-face. Oh, more eyes, I'm sorry. 1.2, 3 joules, 2 passes, 2.1, 2 passes. This case I was real proud of. Sabrina Silver had cancer, and somewhere between her chemo and radiation, that eye dropped, and it never came back. This is what I was able to do with her in 1 treatment. That's 60 days after. This I love too, because this is a young girl. She's only about 36. Her eyes look just sad. This is one of my providers, right after vectoring training. That's a week later. Mid-face. Well, again, now we've tightened up and lifted those eyes. We've worked the orbit, above the orbit, tightening everything up, but what about the face? The face gets flat when we age. There's just no way around it. When it lacks that dimension, you look old, right? It's one of the first things I look at. If I'm guessing someone's age, is that mid-face lift. So to create mid-face vectoring, you go from underneath the cheekbone, contouring. You want to palpate that tissue. Contour up under the cheekbone, 2 lines, one directly over the other, not stacked, but side by side. And then you switch to a vertical lift and go right up to where your lower lash line starts. Then you come back and go laterally, not horizontally, laterally. Go in the pattern you want the tissue to go, and it will go there. I call that the Nike swoosh. And what happens is we get this beautiful mid-face pickup. Now, this is only a 7-day result, so she's going to get a lot more. But that is what we want. And if we work in vectors, lifting each section, look what happens. (1.9), 2 passes. Now, this is my NeoLift, so this result is only 5 days later and continues to get better, and on and on and on. This one, 1.8, 2 passes. This is 60 days later. Lips. In case you haven't realized it, your lips have skin. We treat anything with skin. Why are we ignoring the lips? It's a huge market. We can get beautiful results on it. Most importantly, it takes you 5 minutes to do. How much money are you making? Oh, that's my mic, sorry. Sorry about that. So this is 1 treatment 60 days later. And this is 1 treatment, 2nd treatment, 3rd treatment, a year later. We are able to plump up that tissue naturally. But more important, we're getting a rebound of that beautiful natural color that is what lips look like when they're young. That is 3 lines per pass, 2 passes, starting on the wet dry, going on the dry and the vermilion. 1 extra pass in the philtrum. I like 0.7. I like 0.8. I would take 1, but most people can't take it. And I don't use gel on that, and I don't use numbing. I am, though, going to start a trial of lips at 1.9, because I'm very excited to see what kind of volume I can get. And before I leave this conference this weekend, if any of you have figured out the tooth whitening protocol, please let me know. Oh, I love that. Thank you. I have a lot of providers asking for that. So now we've done the mid-face, the lips. What comes next? Jawline. The jawline is a very specific pattern. I call it a chin strap. It starts behind, you start in the top dead of the submental. Your line goes about an inch below the jawbone, all the way out to behind the ear. That's your first line. Then you come out and go in front of the ear. What you're doing is creating some stability for the lift, and then you're working this first quadrant of the face vertically, always vertically. Now, when you get up near that cheekbone, we're going over laterally, okay? But this is a combination of jawline vectoring, and then what do we do with this? Well, the next pattern I came up with. If we look at why this drops, we all know it, but look at it, right? When you get that submental fullness that we can't reduce, you need to put their chin up in that direction and go from the notch here to the notch here and create a V shape and then work vertically out to the jawbone. That will instantly bring it down and make it smaller. And you'll see it while they're on the table, so you know you're there. That's how we create a contoured face. And that's how we get the results we get. And this works on the whole body. You have to vector the body like you vector the face. If you want to get tightening like that, you have to know how to do it. Like this, you have to know how to do it. So we can do this for every part of the body. When I say every part, Simon won't let me show you every part. But I promise you, we have done every part. This I love. That looks, she's not done by any means because this is only 60 days. But look how much more youthful that profile becomes. This check nest décolleté, home run money. Pardon? No, I don't use numbing. I stopped using numbing 2 years ago. No. That's my husband. You'll hear me say no a lot. So I started testing it 2 years ago. I started teaching it a year and a half ago. I use a method I call NeoLift, and it is a wet method using a very specific gel. So I can treat as high as 4 joules with multiple passes with no lines of being treated. They just have a gorgeous dynamic result that continues to improve. I have about 5,000 treatments a month being done in the US using that method. It's not been accepted and approached by everyone. Some people believe that you must have that thermal injury and that inflammatory response that goes with thermal injury. I don't believe that. I know it to not be true based on case after case after case after case. So when someone gets treated at 3.5 joules, they walk out and they just look like they had a beautiful facial. And that's it. And from there, it just gets better. And we are seeing staggeringly great results. And I'm very, very proud of that evolution. I'm not allowed to talk about it, though. But it is off-label. It is not approved by the manufacturer. I want to be clear. Everything I do is off-label. That's my nickname, Angela Off-Label Salisbury. So if you have any questions, I was told I'm not allowed to take questions right now because they tend to go long. But if you have any questions, I'm happy to talk to you all later. And my contact information is on here. Thank you very much.